Well, there are more Arizonans on ventilators tonight than at any other time during this pandemic, and many families are still planning to hold holiday gatherings. News 4 Tucson's Course Nylander live outside Banner Hospital with what the numbers mean for local hospitals.
Yeah, well, John, according to the latest data, there's only 2% of ICU beds available across Pima County, and across the state, ICU bed capacity has hit its highest level since this pandemic began. More than half of those beds filled by COVID-19 patients, another grim record. It's a Christmas Eve with some unfortunate COVID-19 milestones, leaving medical professionals hoping for a Christmas miracle.
We've seen the COVID-19 metrics worsen. Our cases remain elevated, as does our percent positivity. We are seeing increased hospitalizations and deaths.
That message released Wednesday by Dr. Kara Christ, director of the Arizona Department of Health, urging people to consider the risks of holiday gatherings.
While many people are good about wearing their mask when they are out in public with strangers, many then head home and invite friends over for dinner where people don't wear masks or distance.
Across the state, hospital ICU bed capacity has hit 93%. More than 960 of those beds are filled with COVID-19 patients, a record high.
Many of those patients that would have been admitted are no longer being admitted and sent home.
Will Humble, executive director of the Arizona Public Health Organization, says the situation has led to hospitals statewide having to triage patients and move them hospital to hospital as beds open up.
Sadly, many of those beds come open as people die. They have limited resources, and they have to decide, what's the best allocation of those resources for the patients that they have right then and there, and the risks that those patients have in terms of a bad outcome or even death.
The positivity rate in Pima County surging.
If you look at the percent positivity rate today in this last week in Pima County, it's 20%.
But the real damage from Christmas and New Year's, he says, won't be evident for weeks.
Now we're thinking the exposures that are going to happen Christmas Eve, Christmas Day, and into New Year's are hospitalizations that we'll start seeing in mid-January.
And Hubble says what you can do to help is what's been being asked by medical professionals really through much of this pandemic. Wear your mask, social distance, wash your hands regularly. Now, there is some light at the end of the tunnel, he hopes. He says as the vaccine becomes administered to the most vulnerable and eventually everyone, hopefully he believes those cases could start tapering off. We've got you covered from Banner University Medical Center tonight. Course Nylander, News 4 Tucson.